This is my poster on sex differences in chronotype and actigraphy-measured sleep timing in adolescents with and without ADHD. So for some background, ADHD is prevalent, impacting around 10% of youth, and is frequently associated with sleep problems, which may stem from a biological circadian delay. Females with ADHD are at particularly high risk of sleep problems, but the specific mechanisms that contribute to these differences are poorly understood. And the current literature suggests that males in the general population have later chronotype or more eveningness than females, and that adolescents with ADHD have more eveningness than their peers. However, not much is known about the sex differences in circadian function among adolescents with ADHD. Thus, our primary goal was to investigate sex differences in using two behavioral proxies, chronotype and sleep midpoint or sleep timing among adolescents with ADHD and healthy controls. So to walk you through our methods, we had 62 adolescents aged 13 to 17. Half had ADHD with no comorbidities, and half were healthy controls without any psychiatric diagnosis. And the screening visit involved a clinician-administered diagnostic interview. Then the actigraphy phase involved participants wearing an actigraph for at least 5 days, which provided the sleep midpoint, which is the timing between sleep onset and sleep offset. And then finally, at the follow-up visit, participants completed a self-report of chronotype. A morningness, eveningness scale for children was completed specifically. And a sample question could be, is it easy for you to get up in the morning? All right, so now to walk you through the results, linear regressions covariing for age and race examined main effects of group, so ADHD or healthy control, and sex, and the group by sex interaction effect. So figure 2 shows the morningness, eveningness, and we see that in the healthy control, we see what is generally seen in the population. So adolescent males are more eveningness or have later bedtimes, but we don't see that in the ADHD group. We also see that participants with ADHD reported greater eveningness than the healthy controls. So that means lower scores. So lower scores indicate greater eveningness. And furthermore, females are driving the difference if we look at figure 3, looking at sleep midpoint. So the average sleep midpoint of females with ADHD was significantly later than females in the healthy control group. So to sum all of that up, adolescents with ADHD reported greater eveningness compared to healthy controls, and the difference was greater in females. Females with ADHD exhibited later sleep timing than female healthy controls. And this suggests that females with ADHD may be particularly vulnerable to circadian disruption. And therefore, females may benefit from chronotherapies targeting circadian function like bright light therapy and melatonin. Thank you.